Welcome to Silicon Valley Nonprofits, a service of KMVT Community Media. I'm Bev Lenahan, your host. Today our guest is Michelle Liu, CEO of the Health Trust. Thank you for being with us today, Michelle. Nice to have you.
Great to be here.
Well, great things are happening at the Health Trust, I know. So I'm hopeful that you'll just share with our viewers an overview of the Health Trust. And now I know you have segmented into 3 specific roles. So if you would tell us a little bit about those roles.
That's right, Bev. So the Health Trust is a nonprofit operating foundation based in San Jose. We were founded in 1996. And we are focused on building health equity in Silicon Valley.
Love that.
What that means for us is making sure that everyone in our community has the opportunity to be as healthy as possible. As you mentioned, we play 3 roles in the community. We are a funder, we're a provider, and we're an advocate, all focused on building health equity in Silicon Valley.
Well, I think that can take a lot of time and a lot of effort. So tell us a little bit about the funder role.
Sure. So we provide grants to community organizations in Santa Clara County and northern San Benito County, again, aligned with our focus on building health equity. And we provide over $2 million of grants every year to local nonprofits in the community.
That's significant. That's really significant. And then you mentioned as your second role, provider. Service provider for health equity. Give us some examples of your programs.
Yeah, so we focus on some of the most vulnerable populations in our community, older adults, people who have been formerly homeless and are recently housed, and people who are at risk of or living with a chronic condition. And we provide an array of evidence-based, tried and true direct services for low-income communities, ranging from Meals on Wheels to HIV/AIDS case management to housing support services and much more.
I would imagine literacy comes into play in some cases too, financial literacy, and as some of the services that might be important as people transition.
Absolutely.
Yeah, so much. It's hard to narrow it down, I'm sure.
Right, and given the diversity in our community, we need to make sure our services are multilingual and help people navigate the complex systems.
Yes, and to me that gets into that advocacy role, which is a challenge. It can be personal, or it can be very much community-based or governmental-based. So how do you attack that advocacy role?
We're really proud to be able to be a bold policy advocate in our community, again, for health equity. We focus on systems and policy changes that affect the communities that we serve, again, the most vulnerable populations, and try to be a champion in partnership with other community organizations and elected officials to make sure that everyone has the opportunity to be as healthy as possible.
I love that phrase, health equity. That's very, very helpful, I think, particularly today because it crosses all lines of our ethnic and cultural backgrounds, doesn't it?
Exactly. We want people to have a bite of that healthy apple, regardless of their immigration status, their race, ethnicity, gender, their income level. We want everyone to be as healthy as possible.
That's very visual, that healthy apple. I love it.
Yes.
So how can people get a hold of you and learn more?
We encourage people to check out our website, healthtrust.org, for more information.
Good. Well, we thank you so much for being with us today, Michelle.
Thank you, Bev.
Good fortune.